Miranda, thank you very much. Okay, so get this. It only takes minutes. It's a machine that takes a picture of your skin. Then it creates an analysis showing your problem spots, then offering several solutions. Dr. Mendelsohn is here to show us how Visia works. Doctor, good to see you.
Nice to see you.
I'm not sure that we really want to do this, but if we want to fix the problems, here's a great way to do it, right?
The Visia is a complexion analysis tool,
Yes.
and as you said, it only takes seconds, and it allows us to look at 8 different parameters of the skin.
It's pretty easy. So basically, behind me, we did Rob yesterday. Basically, you put your face inside a machine, takes a picture, doesn't hurt, takes just a couple of minutes,
right,
and then it gives us this.
It does. Wonderful readout. Yep.
Let's talk about this. So lots of different things that you can look at. We kind of broke it down to look at Rob, maybe some of his problems. Easy for me to say, right? Because it's not me, but let's take a look. You can do spots. We're going to look at Rob's wrinkles, if we can zoom in on that one.
Yeah, so first of all, you want to look at the rating here, and this is comparing to a large database of patients with similar complexions. And so Rob scored a 4 with wrinkles, and 4% that is. So 96% of the population, similar to his skin type, are ahead of him. So Rob may benefit from some treatments for his wrinkles here. Things that we might suggest might be Botox, we might use fillers and other skin treatments, maybe alpha hydroxy acids and those sorts of things.
So basically then when he sits down with you and he says, okay, I clearly understand that this is a problem area for me, and then you talk him through some of the procedures that he may want to choose for
That's right, yeah.
Okay.
This gives us the option to offer treatments for him, and we'll use this maybe 3 months following a treatment so that we can follow up and look at our before and after so that we can see how we've done as well, make sure that we're treating
Wonderful.
him.
Let's move on to texture.
Yeah, so the texture analysis looks at the irregularity or the texture of the skin, and Rob also scored a 3% here. 97% of people scored higher than him. So what we might offer Rob are treatments with exfoliation, microdermabrasion, different types of chemical peels. Many patients may benefit from lasers that we use, the dot laser and treatments such as that.
You know, Dr. Mendelsohn, let's talk about that, because I think for most people, it's kind of intimidating, and they're maybe not knowing what you offer. This is a great way to say, you know what, it's not surgery, it doesn't have to be painful, and it doesn't have to be expensive.
Yeah, so much of this can be done at home with good medical skincare products, and within 6 weeks, most patients see a turnaround in their skin anyway.
Really? So that's amazing news. And I would think most people that haven't come to see you or done something like this wouldn't know that. They would probably think the other.
That's right. Maybe if you're female, you may wear a little more makeup to cover some of these things. But these are some nice options. The last one here is...
Yes, I didn't know. Go ahead. I didn't know what this was. What is this called?
Yeah, so porphyrin. So porphyrins really are... this is measuring the excretion of certain bacteria we have on our skin, and there's a bacteria commonly known as P. acnes, and it's the one that causes acne. And if Rob actually scored very well here, but if his score was lower, we might want to consider products that raise the pH of the skin to make it more basic and therefore improve or reduce the risk of acne.
I think we all kind of live in a society, unfortunately, years ago when we didn't realize how harmful the sun could be, and now most of us trying to kind of backtrack, so to speak, and fix those problems. But I love what you're saying. So a lot of the treatments you said can be done at home.
Correct.
It's not that expensive.
No.
It's easy to do. It's just someone like yourself talking us through this.
Yeah, I think one of the things, as you know, skincare is a multi-billion-dollar industry, and what we want to focus on are results. And so medical treatments aren't necessarily more expensive, but they're more therapeutic.
It gives us that extra kick in our step, doesn't it?
It does.
Just makes us feel a little bit better. Okay, so if we wanted to do something like this,
yes,
what does it look like cost-wise?
Yeah, honestly, we generally make this part of our consultation. So patients who come in, we really believe in good skin care and health. Everything that we do relates to the skin. And so we want to make sure that from the beginning, we diagnostically we're diagnosing problems so that we can treat them.
I love that. I told Rob we were going to end on a good note. He's got good bacteria. He
does.
scores very high in the bacteria
Yes,
category. It's called Visia.
It is, yes.
Dr. Mendelsohn, thank you very much.
Thank you very much.
Yeah, good news for us. Just ahead.